It's never easy to help a child manage their food allergies, and all of those holiday treats around this time of year can make it even tougher. Dr. Chitra Dinakar is a pediatric allergist at Children's Mercy Hospital. Welcome to the show.
Thank you.
It seems like more kids than ever have food allergies. Why is that?
That's right. About 18% has increased since 1997, and there are many theories. One theory is we need some bacteria on our gut and skin to keep the immune system in balance, and because there are too many antibiotics and we're too clean, they think that our immune system is changing and becoming more allergic rather than fighting the bacteria. So that's called the hygiene hypothesis.
Okay, so maybe too much usage of that, every time we're using
maybe the antibacterial lotions and stuff is not that great an idea.
What are the more common food allergies?
Well, milk is the most common right now, but there's milk, egg, peanut, soy, tree nuts, fish, shellfish. These 8 make up about 90% of all the food allergies. Of course, you can have a food allergy to other rare things like sesame or spices.
What can parents do early on to help kids prevent those allergies in terms of introducing food when they're very small?
Excellent question. We used to think that we need to avoid all the highly allergenic foods, and then studies showed it didn't make a difference. So now the recommendations are go ahead and introduce the foods in a person not at risk at a normal age, maybe 5-6 months when you start solid foods, doing one food at a time.
One food at a time.
Yeah.
Okay, so what are those common symptoms that parents can see in their kids when they do have a food allergy?
That's right. The most common, obviously, you're eating the food, you're going to get a rash or hives around the mouth, you can get swelling of the eyes, swelling of the hands, rash spreading all over. Those are more the minor symptoms, but you can have major symptoms that'll make you worry, which is breathing difficulty, passing out, shock, or anaphylaxis, which is a severe allergic reaction.
Okay, so what do parents do when they see that first allergic reaction?
Take away the food, wash the hands and get rid of the food, and give Benadryl for minor reactions and watch for progression. If it's spreading, then you may want to call 911. If you have an epinephrine injectable, you give it yourself, but seek medical help if it's spreading.
And you brought one of those EpiPens to show us how it works. Now, for some kids that do have high allergies, they keep these around.
Right.
Just in case. Can you show us how it works?
Sure, go ahead. I'll tell you what to do. Take out the cap.
Okay.
Okay, hold it this way and go ahead and jab the orange. There, did you hear that? Do that yourself.
Okay.
There you go.
And
it's as easy as that. Only thing is you hold it to a count of 10.
Hold it to a count of 10.
Yes.
Okay.
Yeah.
So parents should just keep them on them, especially around the holidays.
Yes, and they should have a food allergy plan like this, which tells the steps of the minor and major reactions. You could have your child's photo, so anybody else who's a caregiver or a friend could also do the same thing.
And at schools as well.
Exactly.
You want to make sure their teachers, their school nurse know what their allergies are.
Correct.
Okay, and so what else can parents do to help prevent those allergies?
Make sure your child knows what they're eating, so ask about what is in it. Read the labels, because if it has may contain, you may want to avoid it. It may be made in that same machine. Wipe the surfaces thoroughly. Do not share utensils. Do not trade foods. Make sure you have the plan. And if you're traveling on the plane, you may want to take your epinephrine and the Benadryl with the prescription in a Ziploc bag, because you can have peanuts in the planes, and that can be a problem. So you need to be worried about that. Those are some of the common tips, I would say, that would help the parents. And of course, always look at what you're eating.
Just be aware, be aware, be aware. Well,
yes.
Thank you for coming on the show. Some great advice. We appreciate it.
Thank you.